So I would say, hey, Mr. Larry, I am here to put a nasal airway in that's gonna help us with suctioning, or help you breathe a little better because it'll stop the obstruction. But you wanna talk to them in like layman's terms. I'm gonna put a tube in your nose that's gonna help us suction you more easily. For the NPA, for the measurement, I'm gonna measure from tip of nose to the tragus or the earlobe. This one is a little long. Tip of nose to earlobe or tragus. This one is a bit long, but for the purposes of observation, we're gonna assume this is a good size, okay? That is how we would measure. Okay, I'm gonna put some lubricant on there so that it goes in nice and easy. What kind of lubricant are we using for a human being? Water-based lubricant. But for our mannequin here, I'm gonna spray the lubricant on top of a chuck so this stuff gets everywhere. You're gonna be pretty liberal with it. Okay, Mr. Larry, bevel towards the septum, okay? Towards the medial part of the nose. I'm gonna put this airway into your nose, so you go in, kinda give it a little twisty twist, but keep your bevel towards the midline, and just advance it until the flange is at the nair, okay? Now with this mannequin, if you look in his mouth, you can actually see the tip of that NPA, so you can kind of like visualize where it goes. How long do these stay in place for?
24 hours.
Less than 24 hours or less. And there will usually be some kind of protocol at your facility about what to do with that. So that's your NPA. Your OPA, you are going to measure, I'll do it on this side and that side, midline teeth to corner of the jaw, the mandibular process. This is actually a pretty good size for him, probably. Kind of right there at the mandible. OPA, you're going to kind of flip it around a little bit. So it's going to end up placed like this, but to place it, you're first, let's talk about opening a person's mouth. I have a coworker that lost a finger, okay? When we open a mouth, we use scissors technique.
Wait a minute, he really lost a finger?
She really did.
Oh, wow.
And I think about her every time I have to stick my fingers in a patient's mouth. You're not going to just push, you're not just gonna push it open with like pinchy fingers. You're going to cross your fingers over like scissors, so like cross.
Placing your
Well, the
fingers on
papers
their
had
teeth.
that showed how to do it.
Yeah, it's hard to see on a paper. You're gonna kind of be on their lip or like gums. You're not sticking your fingers. Don't do this. People will bite you. Even if they don't have teeth, it'll hurt. You're going to kind of open, and it's hard on a mannequin that's plastic. Huh?
I'm just thinking of someone that doesn't have teeth.
It still hurts. Patients without teeth have gums with bones inside. It still hurts. So you're gonna scissor open. So like you're pushing your two fingers in opposite directions. So like practice that, because that's gonna be a thing that, yeah. It's easier on a patient that is human and not plastic. So you're gonna scissor open. When you place the OPA, you're gonna place it in with the curve towards the top until you hit the end of that hard palate. You will feel it even on the mannequin, and then you turn it and you place it. If you try this way, their tongue will fall back. So what you're doing here is you're kind of getting it in, hit that soft palate, and then you're scooping the tongue out of the way. And that just sits right at the lips. Does this one get secured?
No.
No, why not? Yeah. This one is placed in what kind of patient? Unconscious. Unconscious. This one, nasopharyngeal, can be placed in what kind of patient?
Semi-conscious.
Yeah, they can be awake or semi-awake. And that one typically is not secured either.